Welcome to the Woodrow Wilson School. My name is Cecilia Rouse, and I'm the dean here. Today, thanks to the efforts of the Education Research Section, the Center for Health and Wellbeing, and the IELTS Incorporated, we've come together to explore the topic of the impact of lead exposure on our students, what schools and parents can do to help mitigate the problem. It is a topic of great importance, as we all know. In New Jersey, since 2000, approximately 225,000 children under the age of 6, those most vulnerable to the effects of lead poisoning, have been found to have elevated levels of lead in their systems for the first time. The recent water crisis in Flint, Michigan exposed an estimated 8,000 children to lead, and according to a recent article in Time magazine, could lead to $400 million in social costs based on the likelihood of lower IQ levels for those exposed, leading to lost economic productivity, reliance on welfare, and costs to the criminal justice system. While we know that lead exposure can adversely affect behavior, IQ levels, and academic performance, it is rarely considered a factor in education disparities as society grapples to close the achievement gap between urban and suburban children. During the conference today, panelists will explore the impact of lead exposure on a child's developing brain, including lead's relationship to behavior problems and test scores. Important policies and approaches that cut across multiple sectors such as health, education, social services, and housing will be considered. So now please join me in welcoming Elise Pivnik, a city planner who has worked in the community development field for over 30 years. 15 years ago, Elise established IELTS, an environmental health, she established IELTS' environmental health initiative, and has since managed multiple projects that both assess and improve urban environmental health, particularly addressing the challenge of unhealthy homes, both in Trenton and nationally. She is a board member of the National Center for Healthy Housing and a founding member of #LeadFreeKids New Jersey, an initiative behind many recent actions to prevent lead poisoning in our state. Please welcome Elise.
Hi, good morning, everybody. Thank you very much, Dean Rouse. And I want to say a special thank you to Janet Curry and Lisa Pithers, who have been from the Woodrow Wilson School for partnering with IELTS on this conference. And I'd also like to acknowledge that our Assemblywoman, Liz Moyo, is here to learn more about the lead problem. We're delighted that you're here. Thank you. So it is my pleasure to be the second person to welcome you here today. This conference is a long time coming for me. At IELTS, we have been working on lead by testing homes, counseling families, making homes lead safe, engaging in research and policy work for really over the last 15 years. Although I didn't know it exactly at the time, the idea for this conference happened for me about 7 years ago, and it was the first time I ever heard Dr. Jay Schneider talk about his research about how just a very tiny bit of lead affects a child's developing brain, and also forevermore affects that child as he and she grows into an adult. I looked around the room on that day, and it was a Rutgers legal clinic with mostly students attending, and I thought, whoa, this is a message that needs to be shouted from the rooftops to educators. Where are the educators? So how come they aren't here? I believe that after parents and guardians, educators should care the most about lead poisoning of our children, right? They are judged every day by the test scores of their children, the education outcomes of their children. But due to a very strange ignorance, and I emphasize that term, strange ignorance, educators continue to be absent from this discussion. When you consider how we rightly wring our collective hands about the disparities in education between urban and suburban children, you wonder, how can it be that no one is paying attention to lead? I've spoken with school superintendents, school board members, and even special education teachers, and lead has been off the radar for all of these people. An urban school superintendent and a national expert on urban education told me in the same week, almost verbatim, I don't know why we stopped talking about lead. They were kind of shaking their heads. How is it that a White House initiative called My Brother's Keeper, that's been designed to improve the male minority achievement, could create 42 indicators that influence achievement and failed to include lead poisoning? That is just amazing to me. It's remarkable. I call lead the elephant in the classroom. Looking at entering kindergarten data for 13 consecutive years in Trenton, and it's not much different for Newark, Camden, Irvington, and New Brunswick, where we have the data, one can easily conclude that over a 12-year period, at least 40% of the kids in the school system had high levels of lead that clearly had was likely to have been impeding these children from reaching their full potential. Yet lead is not part of the conversation. As you listen today, keep in mind, lead is an issue that starts in health, where we collect the data, but the costs are spread across special education, housing, criminal justice, unemployment, long-term disability, and family strife. As one person pointed out to me, think about a lead-poisoned parent raising a lead-poisoned child, and you'll perhaps think more about that after you've heard all the speakers today. And then think about all of this under the very large umbrella of racism and civil rights. I started on this path to this conference way back then when I heard Jay. And while it's not quite the 108-year wait of the Chicago Cubs, it feels like a long time in my work life. It is a milestone that I hope will be repeated all over the country. The purpose of today is to break down what I call the firewall between health, where lead data typically resides, and education. Let's all think today how we can better meet the needs of our children already affected by lead. First, let's all better understand how insidious a problem lead is, and then let's ask how our educators can identify these children, and what can we do to help them gain early access to services to help them. And then ask what policies and funding do we need from our elected officials to do this right. And then on another day, how can we prevent lead poisoning from occurring in the first place? I hope that you leave today both mad and inspired to help make the changes in your schools, in your communities, on behalf of thousands of children in New Jersey and throughout the country who are already affected by lead. We can do this. It is now my pleasure to introduce Ralph Spezio. Around the same time that I heard Jay speak about his research, I also happened to listen to a TED Talk that Ralph Spezio developed, and about his experience with working with lead-poisoned children in his elementary school in Rochester, New York. So Ralph started in education in 1970. He worked his way up through various jobs, curriculum specialist, vice principal, principal, and he transformed one of the worst performing schools in Rochester to become one of the best performing schools in Rochester. But he's going to tell you about this group of children that still stymied him no matter what resources he brought to the table. And he received the EPA Environmental Justice Award. When he retired from being a principal, he became faculty at the University of Rochester Medical School. And then after a few years out of being a principal, they called him back because they needed him again because the school wasn't doing so well without his leadership. And he's been around the bend on this. He's also the founder of a coalition to end childhood lead poisoning in Rochester, and he's been a very influential thinker and practitioner on the issues of lead poisoning prevention. So it's my pleasure to introduce Ralph.
Thank you, Elise, and good morning. Good morning, everyone. I tell you that I am really, really excited to be here this morning on this really important event, and to have this opportunity to talk with you today. I arrived yesterday from Rochester, and I have been really overwhelmed by the welcome and your hospitality here. New York and New Jersey have so many things in common. And we value very much of the same things as well, especially when it comes to the health and welfare of our children and families. And that's what I'd like to talk to you a little bit about today. I'm especially excited to be able to have this opportunity to talk with fellow educators regarding an issue that I described as a silent and invisible monster that's devouring our children right before our very eyes. And I think, and I believe that you can identify with me when I say that as an urban teacher and school administrator, I have dedicated the better part of my life to creating the vehicle through education for children to have a better life and an exciting, healthy future. For all those years, and not for 1 second, did I ever dream of what I discovered strictly by accident. I'd like to tell you the story of how I backed into something that both horrifies me and angers me to this day. It really was something that I never ever expected, nor ever dreamed that I would find. In the fall of 1990, I became the principal of a school with some pretty severe challenges. Located within Rochester, School 17 had a 98% poverty rating. Many children actually tried to get suspended. Many teachers had just given up hope. And many members of the community had an adversarial relationship with the school. Graffiti covered the building, and clouded plexiglass and metal covered the windows. Inside and outside, it was just like a battle zone, battleground, and nothing like the sacred place for learning for children. Now let's move forward a few years. The school was bright and clean. The teaching staff was devoted and highly skilled. The parents and community were authentic partners with the school. And the New York State governor selected Enrico Fermi, school number 17, to sign significant legislation in our beautiful library. And he declared us a New York State model neighborhood community school. Now, we made a lot of changes, and here's just a few of them. We started with changing the school culture. We simply put children first. All decisions were made with a measure of what is best for children and not what is most comfortable for adults. I stopped the busing, and I created a neighborhood school. And we formed a huge and vibrant urban PTA. And we developed many extensive community partnerships. And we changed the learning environment to make the school an island of safety and calm nurturance for children. The acid test for me, when it came to instruction, was, would I have my own child in your classroom? When I became principal, I found an elementary school, an urban elementary school, with only one half-day kindergarten. And so I had to create a community partnership to actually build a building, and then I brought in a Montessori preschool, which was the first in the district. So with numerous community partnerships, we created an extensive before and after school tutoring program and summer academic school programs. And we created a huge and extensive music and arts program, which included each of the 750 pupils. We literally transformed the academic day, and we almost had year-round school. But if the primary health needs of children in severe poverty are not being met, how can they learn? And many of the primary health needs of many of our children were not being met. So we built the first full-service community health center in New York State attached to a school. And then we doubled the size of that community health center, and we brought in to build a full-service dental center. All this was open to the public, to the community. No one was turned away. So in the 12 years that I was principal, we raised just short of $7 million in private money. And we applied it directly to student achievement. And I did everything I was supposed to do, and much more. We completely transformed the entire school community, inside and out. But I have to confide in you. With all of the changes that we made, we still had problems with a significant core of our children's behavior and learning. Many children would skip anger and go directly to violent rage. Many children would be taught a skill and forget it less than an hour later. Their memory is severely compromised. And it's important to note, and I think this is important to emphasize, that many of these children were coming from good and loving homes. Now, the following point I would also like to emphasize. We had a model school, a devoted, highly skillful staff, engaged parent partners, multiple school community partnerships. We had superb facilities. We had an enriched child-centered culture, but we still had a significant number of children with very serious learning difficulties. So what was missing? I asked myself constantly, what else do I have to do to level the playing field for my children? But with all the model school innovations and changes that we made, it was only strictly by accident that I heard two of our community health center nurses discussing information from a child's medical chart. And when I inquired about what they were talking about, they told me, and I was stunned. So I became the first principal to gain access to the individual and confidential county health records of my children. And I read all of them. And what I found keeps me awake at night, even now, if I think about it. Of the 3, 4, and 5-year-old children who had lived in the neighborhood and were coming to school for the first time, 41% of them had histories of blood lead levels that were over 10 micrograms per deciliter. Now, the Centers for Disease Control state that this blood lead level and levels that are even lower can cause brain damage, resulting in learning disabilities, speech and language impairment, difficulty in reading, violent behavior, and early school dropout. And it's important to understand that many of our children were not included in this 41%, even though they had lead poisoning symptoms, because they had no medical blood lead history. So even though it's required by New York state law. And it's also compelling to note that when I looked into the medical records, 100% of my special education children also had histories of high blood lead levels. 100% of my special ed kids. Now, why is this significant for educators? Our bodies do not differentiate between calcium and lead. They process both substances basically the same way. We know that calcium is needed for bones and teeth, but it's also needed for an essential brain enzyme. And lead is a neurotoxin. So toddlers who are crawling and teething and have natural hand-to-mouth behaviors are most vulnerable because that's the time in their development that they have critical brain development. And that's lead inhibits that growth. This potent neurotoxin creates serious cognitive and behavioral deficits for children. Here's just a few. Hyperactivity and difficulty focusing, aggressive and impulsive behavior, rigid, inflexible problem-solving behaviors, problems with social interaction, the loss of working and functional memory, and learning problems in school with reading, math, language, and writing. And let me pause here for a moment. When it comes to learning how to read, we all know that the letter-sound relationships, phonics, are very important in that learning process. Lead can affect a child's hearing, but not so much to make that child hard of hearing, but it can create auditory processing delays or distortions so that a child is not accurately hearing the letter-sound relationships and consequently is having great difficulty in learning how to read. Now I find that really insidious. Really insidious. And this list does not include the major physical symptoms that go along with this potent neurotoxin. There is no safe level or threshold for lead in a developing child's body. And remember, I documented that nearly half of my elementary school children were coming from the surrounding neighborhood with serious lead poisoning. And if I counted the children who had lead poisoning symptoms but didn't have a history of blood lead testing as required by law, I could easily say that nearly 3/4 of my student enrollment were affected. 3/4. National childhood poisoning expert and researcher Dr. Kim Dietrich once handed me a tiny glass vial, and he told me that there was enough lead in this vial to severely poison a 2-year-old child. So I took the container, I shook it, I held it up to the light, and I said, Dr. Dietrich, I don't see anything in here. And he said, that's just the point. The microparticles are clinging to the inside of the glass. That's how powerful this neurotoxin is. It is certainly not children eating handfuls of lead paint, and it's not just old inner city housing. Remodeling done without lead-safe work practices or homes built before 1978 can both produce a high-risk situation. And as you know, the CDC has updated its guidance on the level of lead in a child's blood, eliminating a level of concern and naming 5 micrograms per deciliter as the new level of intervention. And recently, the Center for Healthy Housing released new findings on the impact of low lead exposure to school performance. These are levels below 10 micrograms per deciliter. Now, this is a little dense, this slide, but I'll go through it quickly. They report in North Carolina, 57,000 children, that's a big cohort, blood lead levels as low as 4 micrograms per deciliter at 3 years of age were significantly more likely to be classified as learning disabled than children with a blood lead level of 1 microgram per deciliter. And they found a dose-response relationship between end-of-grade scores and blood lead levels, and a relationship demonstrated that a blood lead level of 3 micrograms per deciliter and above were associated with decreases in test scores. Now, these findings were replicated in Connecticut. And in another study of 48,000 children in Chicago, as low as 5 micrograms per deciliter were associated with lower test scores in third grade reading and math. Researchers determined blood lead levels had a strong relationship with test scores, similar to factors of birth weight, maternal education, and other factors. And in a new compelling study, brand new, using data from Rhode Island's lead abatement program and repeated blood lead level tests, find that lead exposure among preschoolers can predict low reading scores in subsequent years. Researchers Anna Iser, Peter Simon, Patrick Vivier, and from Brown University, and Janet Curry from Princeton University completed that study, and it's making the earth move. The study, the findings are very compelling, and they're very stark. So we're very fortunate to have Dr. Janet Curry here, as well as Dr. Peter Simon, to really talk more about this study in depth as we go through the day. When the Coalition to Prevent Lead Poisoning in Rochester really dug into the data, we found that, now listen to this, put your seatbelts on for this one. Over 33% of all African American children under the age of 5 in New York State, outside of New York City, live in one of the 36 zip codes identified by the New York State Department of Health as being a high-risk zip code for lead poisoning. Wait a minute. 33% of all African American children under the age of 5 outside of New York City live in one of the 36 zones of high-risk lead. We had to double and triple check that just to make it sink into us. And Rochester is a mid-sized city with a population of 211,000 people. If we were to get the childhood lead poisoning rate in a city the size of Rochester down to 500 children per year, that would still mean that over the 12 years the child takes to go through school, there would be over 6,000 children in that city's school system who are seriously diminished in their intellectual capacity with a high probability of displaying the aggressive and distracting behaviors that are symptomatic of lead poisoning. Now, no school system can successfully absorb that burden. It is absolutely critical that we identify lead-poisoned children as early as possible so that it can be helped to reach their potential. And as a matter of fact, that's exactly what's required by federal IDEA regulations. That's the Individuals with Disabilities Education Act. And most of the attention lately has been given to the urban areas of our country because that's where the density of older housing and the population exists. But suburban and especially the rural areas of our country have been almost totally ignored as to the need for resources to address this terrible problem. So children are breathing and eating and sleeping and playing and living in houses built before 1978 that we know to be a risk for lead hazards. So where is the local and national outrage driving the political will, which would then be followed by policy and supportive funding to finally slay this monster? Now, part of the answer to that question is that the lead poisoning monster knows how to hide really well. There is a serious national gap in childhood lead awareness. And finding, in my opinion, this serious gap in awareness and funding can only be remedied by concerned citizens forming local coalitions to drive the political will that will slay this insidious monster. Very often, substantive change cannot come from within a bureaucratic agency, but must instead be encouraged by outside pressure and support. I cannot give enough emphasis about how important that is, to have an active, sustained, and independent community advocacy group monitoring this issue of childhood lead poisoning on the local level. For example, in Rochester, our coalition found out a few things about the data when we really dug into it. When we talk about the number of children being blood lead tested, it's like throwing darts in the dark, unless you know the exact denominator of the total number of children in the cohort. Often the children most at risk, or children who are the hardest to reach and to test, are the hardest to blood test. So saying that the children, that we're blood testing more children each year doesn't truly mean that much unless we know the total number of children that we're talking about. In New York State, it's the law that children are blood lead tested at age 1 and then at age 2. This law has not been adhered to with fidelity for a number of reasons, especially in the suburban and rural areas of our state. And on top of this, when we dig down into the reported numbers, we find some disturbing issues. When the numbers are reported for children being blood lead tested, the 1 and 2-year-old children are combined and reported together as one percentage. When our coalition did some data mining, we found that very large numbers of 1-year-old children were being blood lead tested, and they had relatively low blood lead levels. But very few numbers of 2-year-old children were being tested, and those children had quite high blood lead levels in Rochester. 1-year-old children, as we know, are infants and are generally better protected. 2-year-old children are toddlers, and they're crawling and teething, and they're experiencing their environment. This coordinates with the time that a child's brain is starting explosive growth. And we all know what that means when a child is exposed to lead. So what happens when you average in the same statistical basket high numbers of 1-year-old children with low blood lead levels with small numbers of 2-year-old children with high blood lead levels? The result is a distortion of what is really happening and a serious reduction in the sense of urgency. And consequently, a diminishing of the political will to sustain the primary prevention of childhood lead poisoning. I love this quote. It's from Alice Walker, the author of The Color Purple. She said, "The most common way people give up their power is by thinking that they don't have any." Forming community coalitions and sustaining them is very important work. The CDC is also a critically important partner for all of us in this work, and it's imperative that it remains at a funding level that allows progress to continue for children and families to be safe. We're so fortunate to have Mary Jean Brown here, the former chief of the CDC's lead division, as a presenter for this conference. Her work in this regard has been extraordinary. The EPA has done a remarkable job in shining a light on the invisible monster of lead poisoning and providing the resources to slay this terrible beast. But they need a strong voice and at the federal level to keep their fundings sustained. We really need to hear the strong and sustained voices of our nation's educators. Teachers are child advocates by default. If you're a teacher and not a child advocate, I don't think you should be a teacher. That's my opinion. But on the other hand, I think that we should really hear the powerful voices of the teachers if we were a little bit more focused with our data. Remember, in Rochester, I found that nearly half of my children were documented as being lead poisoned in just one elementary school. And I got a tremendous amount of mileage from that data snapshot. I recently convinced the former Rochester school superintendent and the county health department to create a cohort of incoming pre-K as well as a cohort of kindergarten children to examine their blood lead histories. There are 2,600 incoming kindergarten children each year in Rochester. I asked the superintendent if he thought it was important that he know the number of incoming children who were lead poisoned, especially as he was asking for resources from the state education department, and especially as it's required by IDEA. And he readily agreed. So we'll have that number very soon. And I believe it will really help us even shine a more strong light on this invisible issue. And we're also doing longitudinal studies as well. So data like this can be developed in any school district in the nation. I know this type of data will help teachers have their voices heard regarding this issue for their children. And I also know that in the last 7 to 10 years, textbooks have been rewritten in regard to the research on the brain. It's just amazing. Researchers, educators, neuropsychologists, and others need to work closely together to bring this groundbreaking research into daily practice within the classroom. Childhood lead poisoning is similar to a child receiving a brain injury. And while it's certainly true that brain injury can affect IQ, the test batteries for full-scale IQ were not designed to assess brain dysfunction and are remarkably insensitive to its effects. Although certainly a valid assessment, I learned from clinical neuropsychologist Dr. Theodore Litsky that IQ represents only the tip of the iceberg when it comes to the clinical evaluation of brain damage of children with lead poisoning. So in order to help each individual child, we need to connect current brain research with classroom practice. And I organized a symposium to introduce that work in Rochester. Now, I'm not a medical doctor or a neuropsychologist. I have never pretended to be an expert in those areas. However, Dr. Theodore Litsky, as a clinical neuropsychologist, came to Rochester, and he addressed a standing room only assembly of Rochester City School District educators at the symposium. And they were very attentive and engaged. We are so fortunate to have Dr. Litsky as part of this conference. Dr. Jay Schneider, professor at Thomas Jefferson University, has completed wonderful research in this area. And he's also a part of this conference. So, let me get back to the story. After I found out that nearly half of my children were coming to school lead poisoned, I was outraged. And as principal, I called a huge press conference to announce the findings of the lead levels of my children. And I called childhood lead poisoning the invisible and silent monster that's devouring our children right before our very eyes. This monster devours a child's potential. And in doing so, it steals their future. But it also negatively affects every single person in our society. We all pay for it one way or the other. In New York State, we have had success with testing 1-year-old children, but over 50% of our county's 2-year-old children are still not being tested. And as I mentioned earlier, when it comes to urban children, the children who are most vulnerable are often the children who are the hardest to reach and to test. And it's often these very children that we read about tragically, almost daily, in our newspapers. Now, there are many memories from the tenure of my principalship that bring me great joy. But I am continuously haunted by the children that we just couldn't reach. And I'll tell you about a mother that represents so many of those challenges, so many of those memories for me. She was a good mother, a responsible mother. Came from a good family. I knew that family well. But she was sitting in my office that morning, and she was weeping. And she was weeping silently, and she was breaking my heart. And I knew why she was in anguish. They were taking her 9-year-old from her that day to be institutionalized. He was hurting small animals and many other children, and he was just so violent that she could not control him any longer. And we could not do anything more for him within the public school setting, even with that wonderful staff. So I pulled the chair up and sat down beside her. And I didn't know what to say, so I didn't say anything. I just reached out and I held her hand. And after a minute or so, she caught her breath, and she looked at me, and I will never, ever forget what she said to me. She said, "Oh, Principal Spezio, he was my brightest child. And on a hot day, I would move his crib over to the window so he could catch a breeze and hear the children playing in the yard and watch the squirrel in the tree next to the house." And folks, I'm here to tell you today that during a critical period of brain development, her child was lead poisoned by the microparticles from that very window where she thought her child would be most comfortable and most safe. And I remember thinking at that exact moment that she said those words to me, this should not be happening. This tragedy was completely preventable. That child should have been protected. He should have been protected. We can reach, not most, but all of our children by doing the following things. We must continue the primary prevention education of lead poisoning to all segments of our society. You cannot protect your child from a danger that you don't know about. We must improve current policies and continuously monitor for effectiveness. And we must continue and establish and support state housing endowments to provide grants and low-interest loans for housing renovation in the urban and rural areas. And we must adhere to federal IDEA requirements to seek, find, and support all children who are lead poisoned long before they ever enter preschool and kindergarten. In Rochester, we're demonstrating that focused, collaborative intervention and regulations really work. The Coalition to Prevent Lead Poisoning recruited diverse community stakeholders into a collaborative process committed to using the best available science. The coalition successfully infused the debate about developing a new lead poisoning law with local data, national analysis, and the latest medical research. Now, as a result of the coalition's advocacy, major progress has been made in slaying the silent and invisible monster of lead poisoning in Rochester. Now, the Coalition to Prevent Lead Poisoning, the City of Rochester, and the County of Monroe just celebrated an historic and precedent-setting lead-based paint poisoning prevention ordinance passed over 10 years ago. And after an often very contentious meeting on December 20th, 2005, the Rochester City Council voted 9-0 to enact legislation that targeted rental housing in high-risk neighborhoods where 90% of the children reported lead poison resided. This law has been hailed as one of the nation's smartest lead laws. Now, in the decades since the law has passed, the City of Rochester Office of Inspection and Compliance Services has conducted over 129,000 inspections, with an overall percent of units passing both visual and wipe test inspection for interior deteriorated paint, with testing data remaining stable at 94%. And more importantly, the Monroe County Department of Public Health has just seen an 85% reduction in the number of children under the age of 6 as reported to be lead poisoned. Now, this lead law has resulted in making thousands of units with lead hazards safe for children. And it's no surprise that Rochester is used as a model example throughout the United States of how community groups, landlords, and local government can work collaboratively together to solve important community health issues. I believe that a civilized society can be measured by how well that society protects its children. That's what I believe. If the adults don't protect the children, who will? The fact that you are at this conference demonstrates that you really care about children and families and the healthy future of our society. And the fact that you are here at this conference and want to learn and want to do something to ensure the primary prevention of childhood lead poisoning, it means to me that you are an authentic hero and champion for children. You are the heroes and champions for children. We cannot stop our efforts until every single child is protected and this insidious monster is slain once and for all. That's how we put children and families first. That's really how we put children first. Thank you.